Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're talking about postural orthostatic tachycardia syndrome, or POTS. This is a condition where the body's autonomic nervous system doesn't regulate blood flow when standing. Patients experience dizziness, palpitations, fatigue, brain fog, and rapid heartbeat. Though not fatal, it can be highly disruptive to daily life. To help us understand this, I have invited Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being here.
Well, thank you for having me. It's my privilege.
What exactly is POTS?
POTS is a disorder of the autonomic nervous system. When someone with POTS stands up, their heart rate jumps up at least 30 beats per minute within 10 minutes. But without blood pressure dropping, that sudden tachycardia leads to dizziness, lightheadedness, and fatigue. Most patients feel like they'd be better lying down.
All right, so you're saying that they stand up, the heartbeat starts beating faster, but the blood pressure doesn't start going up.
Yeah, and they're not getting the blood upstairs. So there's a decrease in the perfusion of the brain. They don't have enough time to fill up the ventricles, and the pump doesn't have any blood to push upstairs. That's what's going on there.
So then we have the dizziness, the lightheadedness, and the patients, like you said, feel better lying down. Well, who has this? I have people coming into my office all the time that go, oh, by the way, doc, I've got POTS. They seem to know, what they have.
You bet. It's a blessing they have a knowledge of it, but POTS most often affect young people, adolescents and young adults. It can appear sudden, sometimes after a viral infection or major illness, and it often overlaps with conditions like ehlers and chronic fatigue or migraine.
All right. Do genes play a role here?
Yes, genetics plays a part of this picture. Some patients have mutations in the norepinephrine transmitter gene that cause too much adrenaline in the bloodstream. It is part of the autonomic nervous system. Other studies show signals in genes involved in connective tissue and nerve signaling. So it's not just one single gene, but a mix of inherited tendencies that raise the risk.
All right. When it starts developing before birth, can they spot it as an embryologic connection?
Well, I think the answer is not directly. POTS is not a congenital malformation. It's embryological because the autonomic nervous system develops from neural crest cells. And if there are genetic tendencies towards connective tissue fragility, like the ehlers, that can later contribute to the circulation problems we see in POTS.
So what does traditional Chinese medicine do for POTS?
In TCM, POTS is seen as an imbalance of Qi, Yin, and Yang. And the patients with fatigue and dizziness are thought to have the Qi deficiency. Those with racing heart and anxiety are often described as a Yin deficiency creating heat. Treatments may include acupuncture, herbal formulas to strengthen Qi in the Yin, and dietary support.
Well, how do you diagnose POTS in your office?
The diagnosis is based on 4 key criteria. The heart rate increase is a pretty big one, at least 30 beats a minute, 40 in teenagers if you're young, and within 10 minutes of standing. No drop in blood pressure, chronic symptoms of dizziness, palpitation, fatigue, and brain fog, and symptoms last at least 3 months that are not explained by dehydration, anemia, thyroid disease, or medications. It's quite the workup. Testing usually starts with orthostatic vitals at the bedside or sometimes a tilt table test to confirm.
All right, so let's talk about this tilt table test you mentioned.
What exactly that is you take the table and you tilt it and you see how the body reacts to the standing. but in a controlled setting so they don't fall. The patient lies on a flat table, then the table is tilted upright, and while the heart rate and the blood pressure are monitored in someone with POTS, the heart rate goes up, but without a big drop in blood pressure. This helps confirm the diagnosis and rule out other causes like vasovagal syncope, where blood pressure and heart rate both fall during the test.
All right. What is the standard of care today in the United States?
We focus first and foremost on lifestyle, increase fluids and salt to expand blood volume. Wearing compression stockings help. Start with a recumbent exercise. Physical activity, fitness is great. So these people need to be in a reclined or semi-reclined position and gradually build up conditioning. Avoid long hot showers, standing still or skipping meals. Practice slow position changes, usually you count to 10, and stress management with yoga or mindfulness. Fluocortisone is used to retain the salt in the water. That's a medication. And the midodrine is used to constrict the blood vessels. Sometimes we use low-dose beta blockers to slow the heart rate.
Let's talk about your regenerative therapies that you have studied and you are using successfully.
Well, this is still experimental, but right now, the regenerative cell therapies used in oncology sometimes cause POTS as a side effect rather than treating it. So research in the nerve repair suggests regenerative approaches like regenerative cells or engineered conduits that support nerve healing and might one day help patients with neuropathic POTS. It's a future avenue, not a current therapy. Another interventional option is stellate ganglion block. That's an injection that goes where the sympathetic nerves congregate and it temporarily interrupts them. Early reports show it may improve symptoms like palpitations, dizziness, and fatigue, especially in the post-viral POTS. But we need stronger clinical trials.
All right. So you mentioned stellate ganglion block. That sounds scary. Are you literally putting a needle into a nerve?
No, what you're doing in those, as in most, is you're bathing the nerve. So you go by where the stellate ganglion congregates. It's localized in the neck. It's the one that controls the fight or flight response. So the injection resets the overactive sympathetic nerve and drops it down.
Okay. What's the long-term outlook for someone with POTS?
Oh, it's chronic but not fatal, and the quality of life can be significantly impaired. But with treatment, it improves significantly. Children and teens often do better over time. Adults usually experience a long-term fluctuating course. The key message is that POTS does not shorten lifespan, but it does require ongoing management and follow-up.
I know you probably have a mnemonic for POTS. What is it?
It's the word STAND.
All right. S stands for?
Symptoms: dizziness, fatigue, palpitations with brain fog.
T.
Tachycardia without low blood pressure.
A.
Adolescents and young adults most affected.
N.
Non-fatal but life-altering.
D.
Daily lifestyle changes are key.
Well, thank you, Dr. Henderson, for guiding us through POTS, a condition that can be frustrating and confusing, but is now better recognized and increasingly understood. If you or someone you know struggles with dizziness, fatigue, or a racing heart when standing suddenly, know that help is available. With lifestyle adjustments, medical care, and ongoing research, patients can find real hope and meaningful improvement. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. DrHelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.